Good morning, everyone. 8:23 on your Wednesday morning. Thank you so much for spending some time with us. Does your teen have trouble focusing? Are you concerned it could be ADHD? Child psychiatrist Dr. Monique Jericho is here now with what ADHD looks like in teens and what parents and teachers can do to help. Good morning to you.
Hi.
Why don't we start with that basic definition? So first of all, what are we talking about? What is ADHD?
So ADHD is a brain disorder, and it's quite a common one. And the way to understand it is to think of two different clusters of symptoms.
Okay.
So people can either have inattention, really difficulties like paying attention, staying on task, staying focused. And then there's another cluster of symptoms that involves hyperactivity and impulsivity. So those are the folks who are always on the go, always on the move, can't sit still, might be blurting things out. So you can either have the inattentive symptoms or the hyperactive impulsive symptoms, or both.
Or both.
Yeah.
Okay, interesting. Now, today we're talking about teens. So what does it look like in teens? How is it different from what we might see in younger children?
So in teens, oftentimes the things that'll get in their way are more of the inattentive symptoms. They tend to have less trouble with the hyperactivity, although they can still have those problems,
Sure.
right? But it's the inattentiveness that can get in the way of things like academic performance, can also get in the way of things like social performance, developing relationships, and so on. And that's the tricky thing in teens, because a child may be able to compensate for some of their ADHD symptoms, but once you start getting into the higher levels in school, both the academic and the social demands increase to a point where a kid with ADHD may not be able to compensate any longer.
Right.
Might start struggling. Yeah.
Right. And so why is it important then to actually get this treated in teenagers?
Yeah, it's really important to get it treated for a lot of different reasons. So what we were just talking about in terms of academic performance, as you're moving into those grades, really, those are the years that's going to determine, are you going to go on to university? Are you going to be able to perform a skill adequately? Socially so important. But then when you think about teenagers and the fact that their brains become wired for risk-taking quite naturally.
Right, that's a natural thing.
That's it. And then if you combine that with impulsivity and inattention in ADHD, then we're getting into risky things like car accidents.
Oh, of
right?
course. They're getting their driver's licenses. Yeah.
Exactly. And so what we know is that people with ADHD, young people, have 4 times the rate of car accidents than their peers without ADHD might have.
Okay.
So we're thinking about accidents now that are a lot more serious.
Sure.
And these types of problems like substance use.
Sure.
People with ADHD, again, have much higher rates of potential problems, right, with substance abuse.
Okay.
Yeah.
Okay. So it is really important to get these teens treated. So I guess that means we need a diagnosis, right?
Yeah,
so
that's right.
if you've got a child and you're wondering, okay, what's going on
What do you
here?
do?
Where do you start?
Yeah. And it can be so tricky because, again, teens' brains are developing. They're becoming potentially more impulsive already because of that increased risk-taking, right? So that can be confusing. Also, we know that teens have higher rates of things like depression and anxiety. Those things can mimic the inattentiveness and the problems of ADHD. So getting that diagnosis is really key. Starting with your family doctor, always a good idea. Family docs have great expertise in managing this condition.
Okay.
If they're having trouble, they may refer you on to a specialist.
Okay.
What you're looking for is you're looking for information not just from the teen, so a good history from the teen, but usually information from parents and also from teachers.
From teachers as well. Oh,
That's
that's
it.
helpful. Okay.
Yeah.
So you're talking to all of these people and you're trying to get that whole symptom profile and then you get your diagnosis.
Ideally, right? Because you want to rule out other things that may be treatable in other ways.
Right.
You want to pinpoint what's going on with the ADHD. And then you want to have a baseline so that when you start treatment, you can see if the treatment is helping.
Okay, terrific. So much fantastic information. Thank you so much again, Dr. Jericho.
Thanks.